With Deputy Paul Murphy.
Mágad ceann Corla agus 100 míle fáilte a gachtain an seo the nurses, the students and their union reps. I'm delighted to see you here in the gallery. I regret that the Minister, Simon Harris, has left, but I think it's even more regrettable that the Minister for Public Sector Expenditure and Reform, Paschal Donohue, is not here. There's no explanation for that. He should be here because he has to answer to why he is not paying these people. Minister Harris, however, before he left, did ask the opposition a question. He said, in your amendments you suggest we pay the nurses, and I'm asking you to explain, if we make an exception for one group, how we explain it to all other groups in the public sector. And I want to offer an explanation, and that explanation is that this group rejected that deal. They rejected it by a huge margin of 94%, and that says something about how they feel about their jobs, their pay and conditions. And secondly, this group are part of a major part of the solution to our health crisis. And if we don't deal with that, we're letting the sick people in this country down, we're letting future generations down, and we're letting all workers in the health service down. So they're not just part of their solution, they're a key part of the solution. And the government seems to reject, with the Public Service Pay Commission, that their pay has anything to do with it. In fact, Minister Regina Doherty on the Week in Politics repeatedly said they're not looking for more money. I mean, get into the real world and listen to what these workers are saying to you. The Public Sector Pay Commission findings, according to Minister Harris, said after in-depth assessment that recruitment and retention issues were a cause of concern, but they could not find them to be a determining factor. It's a complex issue and has many aspects to it. It does indeed have many aspects to it, and I hope you have read the submissions from the Psychiatric Nurses Association and the INOU. They're wonderful submissions, they're clear, they're not rocket science. If you haven't read them, you should. Some of the figures that jump out, and they've been quoted by other deputies here, one, for example, €7,000, the pay gap between nurses and other graduate professions in the health service. That's €7,000 annually. A figure that jumps out at me is that the starting salary of 3 nurses equals my salary. Every TD is paid a salary 3 times what a nurse is paid. The Taoiseach is paid a salary 6 times of what a nurse is paid. And we should think of those facts when we determine the future and the daily lives of other people in this legislation. But I want to focus on an aspect of the submission from the union, which shows you something very, very interesting, and the role that the Department of Public Expenditure and Reform have played. Because allied with certain parts of the media, they've tried to muddy the issues, and they're encouraging us to think that this is about a dispute about the numbers of nurses that we have compared to other countries, that there's no issue, no confusions, that we're not short of nurses, that the higher turnover of nurses in our public services has something else to do with it entirely, and some even go as far as to call them irresponsible because of Brexit. Something absolutely out of their control, nothing to do with them. How dare anyone accuse the nurses of being irresponsible? Now is not the right time because of Brexit. Well, now might be the right time to pay them properly. The Taoiseach and others have presided, and indeed the Minister who's just left, over a system in our health service that is creaking and that is not working. And that means they've presided over a 2-tier health service. They've encouraged private health at the expense of public health. Now, in the submission that I refer to, the unions point out that in the joint employers submission, where they try to make out there's no difficulty with retention and submission, they take out chunks of the HSE submission. The HSE submit that the economic downturn has had a profound impact on the nursing and midwifery resource, with substantial reductions between 4,500 and 5,000 nurses and midwives, and that is a historical fact that has to be addressed. These chunks of the HSE submission were ignored by DPER. They say that the overall picture of nursing and midwifery is one of constant challenge to effectively retain and recruit, and their conclusion is that the pay of nurses must be looked at. Now, DPER chose to ignore that and instead to do a public service pay deal that did not look at the details of what their own organisation, the HSE, not just the unions, but what the HSE have been saying to them. And we've been asked here to provide solutions to say why it is that we should pay the nurses and not pay other sectors. We've also been asked repeatedly in the media and by ministers here, where do we get the money from? I think the nursing unions have given some very good solutions to that, in terms of what will be saved by not having to retain agency nurses on a weekly basis, what will be saved in the Exchequer getting PRSI and tax money back from an increased salary. But I'd like to suggest that there are other choices that this government could make, and that choices that it has made have been detrimental to this country. One was not to take the Apple tax and to keep it in an escrow account. There are billions there that could be used to pay the nurses. You don't have to look far for solutions, and you don't have to look far to see that DPAR are mismanaging the facts in order to undermine this group of workers. I'm 100% for the nurses, and I want to move our amendment.
Thanks.